Good evening, my fellow classmates. My name is Colesha Lyttle, and I'm a dialysis technician. And my informative speech would be today on a kidney disease at a dialysis center. So I've only been doing dialysis for 5 years. And a little backstory, I have an associate's degree in science, and my major was biology. But until I started doing dialysis, I didn't know that the kidney played the important role that the kidney played in the body. I must have missed something in class. Sure, I did, but it regulates your blood pressure by producing hormone, parathyroid hormones. It cleans the body of toxins. It regulates fluid balance. It regulates mineral balance. So I didn't realize it did all this, important jobs in the body. So I take care of patients who have end-stage renal disease, which is kidney failure, which is usually caused by high blood pressure or diabetes. It's the number one and number two causes of kidney disease. There are patients who come in because they've had a heart transplant and they have to shut down their organs, and then they have kidney failure, and that may be acute, not chronic. So they might have their kidney might start working again, and then some of them the kidney never work again. But anyway, what we do in the dialysis center is we clean the blood and get rid of the excess fluid. So every patient has a dry weight that the doctor, the clinician decides is the weight that they are comfortable being without having to have breathing issues or any difficulty. So when a patient comes in for dialysis, we weigh the patients and we see how far they are from their dry weight. We subtract it, and then we decide how much fluid we have to take off them. So our kidneys work 24/7. When we're sleeping, when we're awake, when we're running, it's always working. With dialysis patients, the kidneys work the kidneys may not have any function at all, or may have very, very small, limited function. A lot of our patients have not urinated in years. So all that fluid stays in their body. So they come to the dialysis center, they are fluid overloaded, they can't breathe because it's around their lungs, their heart, it's on their legs, they can't stand up, they can't walk. It's just, it's painful because it's not leaving the body the way it should, the way a person without end-stage renal failure, leaves the body. So we assist them with that, and it's not, because it's not leaving the body, all the toxins that comes up through the urine is there. So they get sick. They get sick because that toxin is built up in the body. So we have a dialysis machine, and what it does is it takes the blood out with one way through the arterial blood and puts the clean blood back in the body through the venous. So we have 3 different axes. We have a CVC axis, which is in the heart. It goes straight into the heart. It comes out of the chest. It could be the right or left side, but it goes straight into the heart. We don't really like CVCs, or catheter they are called, because it goes into the heart. You're susceptible to have infections. If you get an infection, guess where it's going? Straight into the heart. You cannot shower. You cannot get infections in it. You gotta be very careful about cleaning it, keeping it covered. So we don't like that. So we have other axes which are called fistulas and grafts. Fistulas and grafts can be on your upper or lower arms, or can also be on your legs, your thighs. I think we have patients with fistula. No, I don't want to lie. So let me not say that. So we hook them up to the machine. We stick them with needles, 2 needles. One is the arterial, one is the venous. And then the arterial pulls the blood out into the machine, and everyone has their own medication. We use dialyzers, and it cleans their blood. Some of their treatment time is can be range from 2 hours and 45 minutes to 5 hours, 5 hours and 15 minutes. Can you imagine sitting in one chair, one spot for 5 hours and 15 minutes because you need to live? Because without dialysis, they will not live. They cannot live. They're on a special diet. They can't drink certain they can't drink fluids. Even in the summer, which is very difficult, they got to be very careful because then, they have issues and they're not supposed to skip treatments. They only have, every patient has 3 treatments per week. And like I said, our kidneys work 24/7. Even when we're not thinking about it, sleeping, it works. So they really need us. So that's what I do. I take care of patients with end-stage renal failure. And for the most part, I love my job. And we usually try and, make the work light. Because it's a serious thing. I mean, if you don't get dialysis, you die. So we try to make the environment a little light because it's every stuff we're dealing with every day. So that's just a tidbit about it, about kidney disease and dialysis. Thank you. I hope you appreciate it. I hope you enjoyed it. And that's it. Thank you.